national and international journal of repute and 62 research papers presentation as author and co-author. Dr. Nangude has completed 3 granted research projects and 5 books. He is also working as editorial advisory board member and as a reviewer of Journal of Repute. He is recipient of Young Researcher Award at MP Council of Science and Technology, sponsored national seminar at MIPS Indore, and his students also received 9 research awards at various platforms as well as presented at Avishkar state level. Without any delay, I would like to call Dean in Charge Dr. Nitesh Kumar Jain sir to welcome our speaker Dr. Tanaji D. Nangude. Sir, please.
Thank you, Mrs. Raksha Goswami ma'am, for inviting me. So it's again really a great honor and privilege to welcome our today eminent keynote speaker, Dr. Tanaji Nathgude. He's Associate Professor, Department of Pharmaceutics, Dr. D.Y. Patel Institute of Pharmaceutical Sciences and Research, Pimpuri, Pune, Maharashtra. So, sir, on behalf of Faculty of Pharmacy, Oriental University, Indore, I heartily welcome Dr. Tanaji Nathgude, sir, and I'm really grateful to you for accepting our invitation as a keynote speaker in E-International Faculty Development Program. So welcome you, sir, in e-IFDP, sir.
Thank you. Thank you very much, Dr. Nitesh. Thank you. Thank you for your kind words.
Before starting, anyone please can tell me that it is getting aired on YouTube or not?
Yes, ma'am. Yes. Okay.
Tanaji sir, you can share your
screen. Yes. Please confirm, ma'am, is it visible?
Screen is getting shared. Yes, sir. Yes, now it is visible.
Okay. Okay, so before start with the technical session, I'd like to thank to the organizing committee for organizing this wonderful E-International Faculty Development Program, which is the need of the hour in this pandemic situation. As we are connecting virtually more and more, and it is global platform we are open with to discuss different issues in pharmaceutical field. That would be a great opportunity, and that's why I heartily congratulate to all the patrons and co-patrons, chief patrons and patrons for these efforts to organize this E-International Faculty Development Program. I like to thank specially to the Vice Chancellor, Professor Dr. Dhruvagai, Dean, Dean Academic Dr. Garima Ghai, which is always there to support to the Dean Pharmacy, Dr. Nitesh Jain sir. Yes. Also, I'd like to thank Dean Research, Dr. R.K. Jain sir, who is continuously observing involved in the promotion of the research activity through the Oriental University. And the special thanks to the Dr. N.K. Jain. Actually, Dr. N.K. Jain is a big name in the pharmaceutical field, and to match at that standard, this Dr. Nitesh has started with his career.
Thank you so much for your compliments, sir.
Really, you are taking good efforts, continuously involved in the faculty development, student development programs, and that is really in need of the hour. And as a
it's just always a blessings from our senior mentor like you, Dr. Tanaji sir. We have received so many things in terms of blessings and knowledge from you, sir. Also,
thank you, sir. Also, I like to thank Dr. Niharika ma'am for having today's conduct and invitation. Also for a wonderful introduction by Raksha Goswami ma'am. I'm thankful to you also.
And thank you so much, sir.
I'm thankful to Dr. Sumit Dwivedi sir, as they are involved as an organizing secretary to support the convener is required there, and he's fulfilling this. So I like to thank all the organizing committee and patrons for this activity. Also, I'm like to thank to involve me in this activity as speaker. Thank you all. So now I'll start with this session. See, our theme is to understand the integrated approaches in which we can involve the understanding of natural resources, and that should be taken to the drug development and discovery. Really nice area and topic selected to understand, which is, see, nowadays this what traditional applications of herbal constituents or the natural constituents getting converted into a different modern medicines, and that's why to understanding this novel approaches for the natural resources is a need of the hour. So my topic is novel formulation approaches for topical delivery of herbal medicines. I have worked on 10 to 12 projects which is involved this natural phytoconstituents, and I developed novel drug delivery systems with the help of my MPharm students specifically. And out of that, 2-3 case studies I like to discuss in this FDP to understand how we can extend the available constituent at the next level. So we know that herbal medicines, these can be used of different parts, or we can separate different constituent and they can be used as a medicine on understanding of change of physiology or the different disease conditions, or also can be of sometimes in the diagnosis. We know that we are processing this phytoconstituents or the extract or we can say the parts of the plants through the processes like extraction, distillation, purification, fermentation, different processes we are doing and converting into a in required form to be used. But going through this process over these herbal constituents need to be understand the limitation. What are the regulatory limitations we are having for the herbal medicines? Then what are the possibilities of toxicity using these herbal medicines? And then if we are clear about these unwanted effects and regulatory limitations, we are able to take these herbal substances, extract, essential oil, or even the simple juice at the next level of as a medicines. So it is need of the hour to convert it into a novelty form of the dosage. That dosage should have some some new things which can be giving a maximum output, like we can say the solubility, bioavailability, targeted drug delivery system, and so different formulation approach we need to have. Site specific action or local actions with the herbal with the maximum permeation and bioavailability are the challenge, and that should be completed by having a development into a different carrier system. So that is specific area I would like to talk in today's presentation. As we know already, these are the limitation. There is a less compliance of the patient, less results we are getting by using the herbal medicine if it is in a conventional form. Also there we are getting a fluctuation in the outputs, therapeutic effects due to the change in a concentration and all. Means there can be having a different peak values in the plasma concentration. So these limitations of the conventional herbal medicines should be overcome, and that's why we are taking it to a novel form. So novel carrier approach, these are the prerequisites I understand that should deliver the drug at a required rate for a required time. And if we achieved in the herbal category this prerequisite, will having this product as a novel product. Also this carry the active herbal to the site of action. So that two things if we are taken in a mind and we are in a development process of this product, that would be giving a more and more output in the product development. So we need to be understand these benefits should be achieved. Solubility enhancement, bioavailability enhancement, toxicity should be minimized or no toxicity, maximum therapeutic effect should be there, no stability aspect. See, this is the another limitation in the herbal stability. It is more difficult to get a good stable product when it is in a herbal category, easily get affected by the different factors. Mainly the microbial contamination would be the main challenge in the development of the herbal product. Sustained delivery developments is necessary, that maximum time it should be have effect, and there should be a protection from the degradation is also needed. So if we are if we develop the novel product, definitely we are able to achieve this kind of, we need to be having in mind in the development, that should be the rationale for the development of the product. Now these can be the areas where I like to focus more, that how we can improve the stability. So there are options are given. We are having a nano size lipid product development, how we can go for the biocompatibility issues to address site specific delivery. So these are the options are given with each and each focus problem or the objective. Like if we are having in a consideration of we want to avoid the pre-systemic metabolism, there should be some output, like we need to be have a maximum plasma concentration, and for that purpose we are avoiding this. So what kind of processes, what kind of coatings, what kind of changes in the formulations are required? So all these aspects we need to be addressed with the different options to develop a novel herbal delivery system. In which areas this can be done? These herbal products can be useful in all the uh, areas of therapeutic category. So scope of herbal product is large. We need to be enhance it. We need to be used all the areas. Like I have some product in dermatology color affections developed. Like I address 2 products in herbal category for the acne treatment. Even though currently my one project is going on the acne. Even though if we are going for the we can say the this musculoskeletal disorder which is mentioned here, uh, even though arthritis, I develop one herbal gel which can be applied in arthritic condition topically. 5 herbal constituents are added, and that can be useful to reduce the inflammation and the pain. So my point is there are lots of areas available as a scope for development of the herbal medicine into a novel drug delivery system. Now my topic is specifically I want to limit these case studies in a topical delivery. So we need to be focused on when we are in a development of topical drug delivery, it should be more simplest and easiest type of dosage form, and which can be easily apply on the skin. Now we need to be add the properties in our drug delivery system. That properties should control or modify the release. When we are having a simple gel preparation and application, that can provide additional support, but is there any kind of mechanism by which we control the release of the drug? Then another point, when we are applying topically, that understanding of the skin and added property in the formulation which enhance the permeation of the drug. So there can be a different method. We know that we have a proper selection of vehicle, co-administration of chemical enhancers, and that can increase the this permeation of the drug. See this slide showing different options of topical novel drug delivery system, or we can say the novel drug delivery systems from which we can select for the topical approach, and from which I'll going to discuss some kind of case studies. The first case study I want to discuss transporosomes. As in this slide shown, different somes or lipid drug delivery systems are available as in a novel category nowadays. And in that there can be liposomes, nuosomes, pronuosomes, transporosomes, ethosomes, and many phytosomes and many zomes are available. Transporosome is one of the category of lipid vesicular drug delivery system which is having a elastic and ultra deformable property, and which is useful to be have a developed under a topical category to easily can go through the pores, and more permeation can be achieved as it is having a ultra deformable property. So we need to have a proper low and high molecular weight drug selections, and we need to be develop these transporosomes. Now it need to be understand the difference in between the arrangements of the selection of proper phospholipid like phosphatidylcholine, and then can be increase the bilayer and permeability to known these components that to that specifically the lipid bilayer softening component that can be known as age activator, which would be more supportive in the topical drug delivery in the transporosome. So transporosome I have prepared to address the hyperpigmentation problem. Skin pigmentation issue was taken, and in this there we know the excess production of melanin, and to control that and to treat this pigmentation we were prepared transposomes which can be applied topically. So this is the problem in hyperpigmentation. We can see the difference between the light skin and the dark skin. So specifically we can identify the melanocytes from where the melanin production would be more, and then the skin problem in the hyperpigmentation in this picture can be easily observed. Now, what is specifically required? I selected one flavonoid glabridin, and it can be useful for the development of the product. That we need to have a proper reduction in the possible side effects and easy application of the topical product to control this hyperpigmentation. This method I have used, that is the thin film hydration technique, and that can be useful for the development. This is the common process we know for the development of the lipid vesicular drug delivery system, which is useful to use also for the development of the transposome. We need to have a process parameter optimized. Specifically, the when we are converting this film into zomes, lipid vesicular drug delivery system, that what are the force, or we can say what are the stress application parameters like sonication process. There we need to have some optimization to get the control over the size and form of the this kind of transposome. So this is my study. In this case study, we need to be address all the properties, all the issues related to the formulation, and then need to have a proper in vitro and in vivo characterization. We need to be confirmed by SEM, TEM, as well as we need to have some zeta potential determination, proper analysis of particle size, that what range we need to be achieved. In vitro drug release, in vivo drug release, we need to be addressed of through the diffusion process. Then we need to have a preliminary FTIR study followed by another DSC and XRD studies of the formulation. So these all evaluations I don't want to elaborate and discuss more in detail, but we need to be address these studies, and also we perform histopathological studies and stability studies of the formulation. Through all these evaluations, we got a result that transposomes were successfully prepared, and we are in a process to get a more and more output of this product. So in a point of discussion of outcome, this is the formulation which is prepared, loaded with the transposome and without the transposome in shown in both the containers, which expected to give the better patient compliance to reduce the frequency of applications because of control is there. And output of this work, we got one review is published, research article in process of publication 2. Then we got one consolidated prize at national level research award competition for Associate Pharmavention. And also this product, when developed, this project represented in a Avishkar and reached to a top level round of university in Avishkar 2016. So 3-4 outputs by developing a one product, until we are working to get more output in 2020 also. The another case study is of nanoparticle. This is another type of drug delivery system we can have, which would be which can be get developed in a different form. Like we know, easily we are able to get the encapsulation of these constituents by our conventional methods. Now, if we are some modifications in the method and we control in the size of this kind of drug delivery systems, there we are able to get a maximum output of development of this herbal medicine. What we are required, what we need to be achieved by nanoparticle development: solubility enhancement, definitely, efficacy enhancement, bioavailability enhancement, dose reduction, improve in the absorption of the herbal medicine. So to counter the problems associated with the herbal constituent, that is the poor solubility problem and the toxicity problem, we need to have a development of this kind of drug delivery system in the herbal category. That is to deliver a small particle size, has a quicker dissolution in the blood, and it increase the total surface area of the drug. So we need to go into this, and I have this case study in it to discuss. My one of MPharm student developed this sunscreen lotion, which is a nano form, and the main ingredient was curcumin, but which is associated with the another 3 ingredients, and which is specifically made as a sunscreen to protect the UV which affecting to the skin, and these problems like sunburn, DNA damage, skin aging can be controlled by having this formulation developed. So this is the case. We need to be understand of what level we need to be have a protection by developing a sunscreen lotion. That UVA affecting to the dermis, UVB affecting to the epidermis, and so we need to be have a protection at a proper level that can be protect the UVB as well as UVA. If we develop this product, we can understand we had in mind that product should be stable, even though at low temperature, which can be useful at where the geographical regions, the low temperatures are there. And also we work to develop and evaluate this natural product to get the high effectiveness and low toxicity of the product. These are the other ingredients were involved. Novelty were added in the product. We had a multifunctionality of the product. Nano formulation was developed. No toxicity. Herbal constituents are included. There can withstand with low temperature, with solidification, and no cracking. No formulation in the market with the given combinations. So we had a polyherbal nanoparticulate formulation developed as a in an emulsion form, and which can be useful as a product as a sunscreen lotion for topical application. Also, we use QBD approaches in development of this herbal product. I'm not going to discuss the experimental method of this product development. Okay, but this is what the evaluation of this product, we need to be again determine properly the size, what we were expected and achieved or not. Then zeta potential determination is required. Here we can understand no phase separation and enhanced solubility by this photograph we studied. So stability study is most important in herbal formulation. Characterization again by using the FTI, DSC, XRTs for these formulations is essential. We also studied SPF, which is more important in sunscreen product development, antioxidant activity, drug diffusion, antimicrobial. Our product were in standard limits we achieved, and we developed this product. And also we went for a study which can be understand actual effect of the product, and this comparative table is given here, which can focus that even supported by the animal study, it would be more useful if we are having this herbal product developed. This is the output. This container is our container. We made the packaging of the product and represented at various level. We achieved this product with high SPS factor, good antioxidant activity, potent antimicrobial activity, no skin irritation. This project were selected at university level and then taken to the next level, that is at a state level of Avishkar in 2018. Also got first prize in one national seminar in a poster presentation competition, and another first prize in another national level product of program of Tech Manthan 2019. Means if we are develop this kind of product and if we are represented at a standard platforms, yes, we are getting recognized. This project possible to have a polyherbal formulation also successfully developed. But the situation we can see in this photograph on the road also, this herbal or product from the natural sources are getting sold in the conventional form in different sachets and packaging. Why this situation is there? Why not this kind of products get developed from the previous platform? Why these are not getting developed in the phytosomes? See, here are some products as an example. All these are available in a phytosome. Even the last product for the in a perfume category, it is available from the herbal category in a novel form. So we need to be shift this picture into this picture, then we'll get a maximum output of development of the product from the natural resources. Then we had visit at one place where we observed this plant, which is known as a Kailaspati, also known as cannonball, Corpita gonensis. And we just search on Google what is this plant is and what are the medicinal uses of this plant, and we seen that yes, this is having a maximum areas covered in a therapeutic category to be used, and which is not exposed in India properly. And it is also not available in all geographical areas in India. It is in one of the botanical garden in Savitribai Phule Pune University. We got this plant And so I decided to go with this plant for the product development as a next product. And I started to develop the product in a novel herbal formulation for wound healing with this plant. Also, I have taken another project for diabetes with the same plant. And these container are shown in this picture. We taken from Aptar packaging industry, which is developed as per our requirement, that can spray even though we are having a good viscosity of the product. And we developed this product with the concept that is will give the hydrogel layer after the application of the one spray on the wound, and the second spray we can apply which give form the film which covers the hydrogel layer which contain the medicine, and it would be long time on the wound. For develop this film, we are having this mechanism which is shown below. Ketosan PBA glycerol combination. This can be useful to have a cross-linking and development of film which would be more stable. And we will develop this product successfully. The social relevance for this product was to, in case of accident cases, sports injuries, where also the hair areas where easily can spray and apply, which was difficult with the patches and other opportunities, and low rate, so it can be economic to develop the product. We went through the extraction process of same product. We taken leaves of that plant, then we taken a method to get a form a film with a cross linking of this process. And also we use this optimization process for the development of the film, that how much of drug we are getting released from this hydrogel from the film, and what tensile strength we are getting for this film. Then other evaluation studies also performed for this herbal product. Mainly we went for animal studies, and we really seen that how much of days we are requiring. So when we are having this plant, it is effectively getting wound healing done. Also, we added another ingredient, and we are developing another product. Humectant is added in this product now, and we are in a process of development of this product to control the bleeding, and we were successfully develop this product. See the output of this product also. We got economic product, which is spray, hydrogel and film forming product, which can be more supportive and useful. Now, one publication is done with the same topic. See, this product were represented at Avishkar, and something happened good in Avishkar 2020 in Mumbai University state level. This product got selected. So the one of the project in this group is with my student. Also, we got award at state level, Young Pharmacist Innovative Project Award at Mumbai in another competition with the same project. Then one of the award we received in international conference, which is conducted in Maharashtra, Nashik. So we can see the 3 award, 1 publication, 1 product is ready in simple concept. If we are added with the herbal product, that is the novel drug delivery system. So these 3 case studies I was interested to share with you all. So my remark with this case studies is the novel drug delivery system of herbal drug is a need of the hour, and yes, definitely it is getting done in all the areas. It is having good therapeutic potential which need to be exposed. Phytotherapeutics need a scientific approach to deliver the constituent in a novel manner to increase patient compliance and get off repeated administration. This can be accomplished by designing novel drug delivery system for herbal constituents. This is the picture. These all certificates and trophies with the students which work on these 3 projects. This picture were taken just before the lockdown started in March. So that picture was taken in February. So there also some things happened good in 2020. These all 3 projects was I represented as case studies, was appreciated by our dynamic principal, Dr. Sohan Chitlange sir. And the students were blessed by him, and that time we were taken this picture. So when I represented these 3 case studies, I like to thank them also for their contribution behind the development of these herbal products. Thank you very much. I have done with my presentation, and we can have some discussions.
Thank you so much, Dr. Tanaji sir. Really, it was a very nice presentation by you, and you have given a lot of information and valuable insights on the topic of research. I hope every participants of this EFDP will enjoy the series of questions and series of answers which is given by Dr. Tanaji Nandgure sir. So it was really a very nice presentation.
Thank you, sir. Thank you very much.
So I request
any questions from participant side?
Any point, any discussion if required to do, we can have. Also, you can contact me anytime. If anybody is working on development of herbal products, I'd like to share, I like to contribute definitely. So we'll be having an interaction in future also.
Hello, sir. I want to ask one question.
Yes, sir.
It is though it is beyond your presentation what you have presented here.
Okay.
Sir, I want to ask whether transdermal patches are excellent for antifungal infections or not.
Sir, it depends. Means I can't say it's better or no, yes or no. We can't state this, but it depends upon what problem, for what problem we are developing transdermal patch. The one thing. Second thing, which type of transdermal patch? That transdermal patch are of different types. We are having reservoir system. We are having a the layered system. Then how many layers are there? What side? How much of time release is there? What therapeutic means? What for problem we are applying this patch, and which area we are applying patch? So if we answered all these questions, definitely the transdermal system is a better option for the topical application of for any problem. As in last year only, I will develop one synthetic drug was there, but I developed one antipsychotic transdermal patch. So lots of questions were asked for me, why you are going for transdermal patch in antipsychotic category. I justified it and I develop also, and I am still working on the this micro needle patches for transdermal.
Sir, where you have applied that, what is the region of application of that transdermal patch of antipsychotic?
It is we need to have a more muscular area for the application. That is only the need.
Okay. Okay.
So that is only the need. But when in a herbal or natural sources and we are developing transdermal patch for dermal problem, as Dr. Sumit sir were asked, the patch should be simple, I said. Easily, because see, availability of more herbal constituent needed at the site. So that should be like one of the reservoir for gels, like hydrogel patches are available. So one reservoir for the gel should be available at the base, and it should be continuously available at the area. So maximum constituents will be available for the action. So that is the basic need I can understand. But yes, this is also one of the great options, sir, to develop a product.
Okay, fine, sir. Thank you so much, sir.
Thank you. I like to add on that one patch I was prepared in 2016. That was for gingivitis. Means even though inside the mouth we can apply the patch there, and which is having a one side drug release only. So that control we were added at the another side, and it can be kept for 6 hours only in the mouth. So that need to be repeatedly changed. But we were tried and we were also published that paper at good journal. We are getting good citation for that.
Basically, why I asked you the question regarding fungal infection, that I too developed for this antihistaminic herbal patches of cinnarizine. Meanwhile, when we are going with fungal infection, so because of some kinds of irritation and all, might be chance that while applying this transdermal patch, it will delocate from the actual position.
Sir, that is the one problem, delocation. Another is problem, the infection can be spread at long areas, more areas can be there, and we are not able to provide that much of patches, that much of area we are not able to cover. So in that area, it is difficult to develop the patch. How we can, if it is spread, this infection is spread, we are not able to place patches at the all areas. So it would be better to have a simple topical formulation which can be easily applied. So that would be in consideration of patient compliance. We can't go in this area for the patch.
Yeah. Okay, sir. Thank you.
So
Sir.
that is my thought.
Yeah.
Sir, you have developed that sunscreen lotion using curcumin, sir. So is it not get stained, sir?
No. See, we were taken extract. See, even though we were tested for it is actually protecting UV rays or not. Regarding staining, I'll talk first. Curcumin is one of the ingredient, but that is having a major action. That's why we name it with nano curcumin. But the other two ingredients positively supporting synergistic action. Curcumin, where we depend upon from where we are taking the extract at which standards. According to that, this also we can see powders we are getting of different yellow colors. So what are the processes done and what are the standards? We need to be see that again, and we need to be taking very small quantity in the formulation. So even though we were use it, it was not staining. Even the curcumin sunscreen products in herbal category available in market, but it is not available in a nano form. So we made converted into a nano curcumin emulsion form. So that can be more. We were expecting the more protection from the sun. SPS factor with the herbal, to get the good SPF factor with the herbal is really difficult. We need to be added in the another constituent. You know that zinc were added in the product and which is harmful to be used. So better to go with the good SPF with the herbal products.
Sir, I just want to ask one more question means regarding that just Sumit sir has asked that for the transdermal patch in for antifungal, yes. So sir, you just said right now that we have apply this transdermal patch wherever we have. We cannot apply just transdermal patch once at a time at one place so that it gets absorbed through the skin and it just gets circulated the medicine.
So I was talking about the local action.
Okay.
So you are
because fungal infection just spread our body through the blood, sir. Because if it had only at one place, it will get spread all over the body.
Correct.
Places.
So yes, this way it can be used now. This way, if it is going through the systemic
use of that particular drug.
Then it can be used. I was talking about the topical local action. For local it was then for long-term drug release, and we not need to have a multiple dose frequencies, so that would be more applicable.
Okay, sir. Nitesh, sir.
Just a minute, actually, after the concludatory section of Dr. Tanaji sir, we will go for the valedictory function also. So we will start this valedictory function at 1 p.m. sharp. So we will wait for this. So please don't leave this.
Okay.
So please.
Okay, you are having same link and
yes, sir. Yes.
Okay. So if you that was the plan. Yes.
If any research scholar want to ask something or want to discuss something with Tanaji sir, you can just discuss it, or you can just put.
Definitely. Even though other than the topic related to the formulation development, I just like to share one news with you all. Yesterday, AICT had concluded the conference with the CII, and AICT declared the awards yesterday in the valedictory function. I like to share with you all, our institute received consecutively second time the best institute in India, which is having a industry relationship under the AICT CII survey.
So many congratulations, sir. Very nice, sir.
Thank you. Last year we were received this award, and they are giving only award for one institute in India in pharmaceutical category, which is having a good relation with the industry. And again this year we got selected with the because of the dynamic leader Dr. Sohan Chitlange sir and support of the management and all HODs and all senior faculties working hard to develop good relationship in a research and training and placements with the industry. And thank you all
That's
for
very
your
nice, sir.
wishes. Thank you very much.
Any research scholar present over here want to discuss something regarding your research, then you can just discuss here. This is a very nice platform.
Yes.
Uh,
Or I request any
so I
research.
request Mrs. Raksha Goswami ma'am for conclude the session of Dr. Tanaji Nandgode sir.
Yes, sir. Thank you so much, sir, for enlightening us by your innovative ideas and thoughts. Now, I would like to call convener of e-IFDP, Dean in charge, Dr. Nitesh Kumar Jain, sir, to felicitate Dr. Tanaji Nangude, sir. Sir, please.
Yeah, thank you, Mrs. Raksha Goswami ma'am. It's again honor to me to give felicitation to our beloved mentor, Dr. Tanaji Nandgode sir. So, sir, on behalf of Faculty of Pharmacy, Oriental University, Indore, please accept this certificate of appreciation as a token of our love and your gratitude. And really, we are very grateful to you for accepting our invitation as a eminent keynote speaker in International Faculty Development Program. And you have given a lot of valuable insights on the research. So thank you so much, sir. Thanks to you, sir.
Thank you very much, sir. It's my pleasure to discuss and share the ideas, and also I'm getting learn new thing. Definitely, I'll think in future to develop one antifungal patch as we had discussion. So this is all. This is the platform where we can share the ideas and we can learn from each other. And thank you to create this platform, Dr. Nitesh. Uh, and thank you for involvement.
Thank you so much, sir. So, ladies and gentlemen, as we didn't have so much time for the validity function, as our Honorable Vice Chancellor of the university and Dr. Garima Ganga ma'am are busy in some important meeting, so they are unable to come in this validity function. So, I request Dr. Sumit Dobedi sir to start validity function right now. So, just we will conclude with the vote of thanks, and Dr. Sumit will give brief about the 5 days EFDP program.
Okay, so very good afternoon to one and all. I, Dr. Dwivedi, on the behalf of Oriental University, Faculty of Pharmacy, Oriental University, Indore, feel glad to share a glimpse of 5-day e-IFDP to 2020. So we have started with the inauguration of e-IFDP 2020 with the blessing of our Chancellor, Dr. K.L. Takral sir, and blessing of Vice Chancellor, Dr. Duvagai sir. On that particular vision, which was initiated by the chairperson e-IFDP 2020, Dean Academics, Dr. Garima Ghai ma'am, we have started our first day invited lecture of Dr. Bimal Jain sir. Sir has given a very brief insight about the supercritical fluid and how we can go with the herbal utilization of the same on 8th of December 2020. On second day, we have two renowned lectures of Dr. Seema Kohli ma'am and Dr. Dipen Singh sir, who has enlightened how we can utilize the herbal and the phytoconstituents for novel drug delivery systems. In this particular lieu, the role of reverse pharmacology has been discussed out by both of the speakers. On third day, we have with us Dr. Idris from Libya, and they have given a very good insight about the medicinal plant and their utilizations. Further on, moving to the next, we have a very good lecture of Dr. Shali Zahabi from the Egypt. She has given a very brief insight about the neosomes and how we can use the phytoconstituents for the development of neosomes for anti-inflammatory and anti-diabetic perspectives. Meanwhile, in the last session of EFIFDP 2020, we have two eminent speakers, Dr. Ashutosh Barve sir, who has given a very good results and their studies on peptide phase therapy and how we can be able to develop medicine which can cross the blood-brain barrier. And finally, at the last of the day, Dr. Tanaji, he has given an excellent lecture on the drug delivery system utilizing the phytoconstituent and the extract. So again, It was a great pleasure for me to give vote of thanks for this particular event. Indeed, this 5 day was a very tight schedule for all of us, especially Dr. Niharika Gokhale ma'am, who has given a
Thank you,
very
sir.
brief means insight. She was busy out
Absolutely
of
right,
the
sir.
way from the college also. She just prepared a Zoom link and all of the faculty members, especially Dr. Gurdeep Singh sir, Dr. Neetu Singh ma'am, Apurva ma'am, and all our faculty who are directly or indirectly engaged with the success of this particular event. Last but not the least, I would like to thank upon our young, dynamic, and ever lasting. I don't have words right now to express my deep sense of gratitude to our Dean in charge, Dr. Nitesh Kumar Jain. And thank you so much, sir, that you have given us all the way that we are in the continuous motivation and continuous growth towards the upliftment of faculty of pharmacy, Oriental University, Indore. Thank you to one and all.
So thank you, Dr. Dubedi, for a wonderful conclusion of e-IFDP program as a valedictory. But I will take a couple of minutes to thanks my team. So I will start from Honorable Management, our Honorable Chancellor, Dr. K.L. Thakral sir, our beloved Bauji, for his blessings for entire event of Oriental University Indore. He's still a very dynamic personality at the age of 92. And again, we are very thankful to our Honorable Chairman, Dr. Praveen Thakral sir, Chairman, Oriental Group of Institutions. And we are very lucky to have Honorable Vice Chancellor, Dr. Dhruv Ghai sir. He has a very distinct vision and he is almost supporting in all events with his blessings and guidance. And we are very much fortunate to have our young dynamic executive director, Sri Gaurav Thakral sir, for his continuous support and for the upliftment of pharmacy department. And the chairperson, e-IFDP, Dr. Garima Ghai ma'am, Dean Academics, Oriental University Indore. She has given a lot of guidance, support, and undoubtedly she has given a lot of things and she has given permission to conduct this e-IFDP in a very well manner. So I'm very thankful to our honorable chairperson, e-IFDP Dr. Garima Ghai ma'am, and I'm very thankful to Assistant Director Sonia Thakral ma'am. And we are very thankful to our Dean Research, Dr. R.K. Jain sir, for continuous motivation and support to conduct this type of event. And we are very thankful to our speakers from abroad, Dr. Salil Jahabi ma'am from Egypt, Dr. Idris Hamad Atitala from Libya, Dr. Ashutosh Barbe sir from USA. And we are very thankful to our national eminent keynote speaker, Dr. G.D. Gupta sir from Punjab University, Principal cum Director, ISF College of Pharmacy, Moga, and Dr. Dipen Singh sir. He's a member Pharmacy Council of India, belongs to Chhattisgarh. Dr. Seema Koili ma'am, Professor and Head Department of Pharmacy, Polytechnic College, Jabalpur. Dr. Bimal Jain sir, School of Pharmacy, IIT University. Dr. Anand Chitapura, State Professor, Maharashtra. And Dr. Tanaji Nadgure sir, our today eminent keynote speaker, for his valuable insights. And now, at last but not the least, without whatever I am today, just because of my team, my beloved team. I will definitely, I'm very grateful and it's an honor to give vote of thanks to my team. They have done a wonderful job in entire e-IFDP instead of their busy schedule in academics activity, examination activity. So I will start my vote of thanks to my beloved organizing secretary, Dr. Sumit Dwivedi sir. He's always dynamic in all field and all, and he's very supportive. So thank you, Dr. Sumit Dwivedi sir. And now I would like to thank the chairman, host committee, Dr. Niharika Gokhale ma'am. Really, she has done a
Thank you
very
so
wonderful
much.
job. There was no disturbance in hosting the event, and she has given a lot of opportunities to all the young colleagues for hosting the event in the different session. So it was really very nice initiative by Dr. Niharika Gokhale ma'am. And I'm very thankful to Dr. Gurdeep Singh sir for his entire support and continuous help for our all faculty members. I'm very thankful to Dr. Neetu Singh ma'am. She has hosted almost 2 events as a host. She has done a wonderful
Thank you,
job,
sir.
and I will congratulate her also. And I'm very thankful to our Miss Surbasi Sharma ma'am. He was she has the host in inauguration ceremony, and today actually she has her birthday. So on behalf of Faculty of Pharmacy on this platform, I really wish happy birthday to her today. Now we like to thank Ms. Apurva ma'am. She has given a lot of support to Dr. Niharika Gokhale ma'am. Really, she has done a wonderful job. And I'm very
Thank you so
thankful
much, sir.
to Ms. Deepika Bairagi
Thanks
ma'am.
to you, sir.
Thank you. Ms. Deepika Bairagi ma'am, she has really done a wonderful job in terms of certificate preparation and all. That's the silent worker, but she is very dynamic. So really, I'm very thankful to Deepika Bairagi ma'am for her kind support in all event. And I'm very thankful to Mrs. Raksha Goswami ma'am. She has done today very good hosting. So I congratulate her also. And I'm very thankful to Mr. Rahul Sisodia sir, Mr. Siven Dovedi sir, and for his continuous support to this event. And I'm very thankful to Dr. Neelam Khan ma'am as a chairman certificate committee. She's not here, she is today on leaves, but she has done a wonderful job. And Mr. Deepak Kumabas sir, I'm very thankful to my colleague, Mr. Deepak Kumabas sir, for his support and all. So really, I'm very thankful to my all team members. You have done a great job, and this was a great event, which is very successful. It's just because of all my team members. So thanks to all from the bottom of my heart. Really, please accept my gratitude towards your dedication and commitment for the successful completion of this year. Thank you so much.
Thank you and
Thank you
congratulations.
so much, sir.
Congratulations.
Congratulations to all the organizing committee for successful completion of this event. Congratulations.
Thank you, sir.
Thank you,
Thank
sir.
you once again, Dr. Tanaji Nathgoe, sir, for today eminent speaker. And I'm very thankful to you, sir. Thank you, sir.
Thank you.